Hi, my name is Jamaica Brown, and today I'm going to be demonstrating the IV piggyback. To start off, I would have my doctor's order and my MAR, and I'm going to be comparing it to make sure that it's the right patient, right medication, right dose, right route, right time, right amount. Next, I would check for any allergies that the patient may have, and it would be on the MAR. After that, I would compare my MAR with my medication to make sure it is the right medication and the right amount. All right, while in the midst of doing that, I would look at my IV drug book and I'm checking to make sure that the medication is a safe dose. And it is, because the book says it's 12 grams per 24 hours. My total was 750 milligrams. So it's definitely a safe dose. I'm also checking for the dilution. It says I can use 50 up to 100 milliliters. I have it in a 50 milliliter bag of solution. I'm also checking to make sure that the solution that it was diluted in is a right solution that it's compatible with. Also, in checking for the right solution that is compatible with my patient already has an IV line running, so I want to make sure that the 5% dextrose is compatible, which per the drug book it is. Also, I'm checking for the rate of administration for the intermittent IV is over 30 minutes. And I will use that 30 minutes to do my drug problem to get my correct rate. Also, in assessing for that, I'm looking for any lab or any drug interaction. So if the patient had another drug running, make sure it wouldn't interact. Also, if any lab values that I would need to check or assess before I gave the drug, this is what I would be looking for at this point. Okay, so once all that is done, and like I said, I'm going to use my 30 minutes with my 750 and my drop factor, and I'm going to get 16 drops per minute. So now I'm ready to gather my equipment. So first I'm going to wash my hands, and then I'm going to get my equipment. So I have my medication, I have my IV tubing, I have my little hanger, I have my alcohol swab. Because the IV is, the fluids that's already running is compatible, I don't need a flush or anything like that. So at this point, I will go ahead and set up my stuff. So I'm going to take this off. Take this off. Put that in there, making sure that I don't contaminate it. Okay. And then I would put a little in the chamber. Just enough that I can prime my line, and which in priming my line is to get out any air bubbles to prevent air embolisms. So I would unroll my clamp. Okay. And then once it runs and I see that there's no line, I'm going to roll it back to prevent medication from spilling out. And I can go ahead and put the top back on it, just to make sure I don't introduce any microorganisms or anything in there. At this point, I got everything done. I'm ready to go to the patient's room. So before I go into the patient's room, I'm going to wash my hands again or use a hand sanitizer that's outside the door. I'm going to introduce myself. Hey, my name is Jamaica. I'm going to be your nurse today. The doctor has ordered for you to get 750 milligrams of chlorephrine, and I'm going to be doing it through your primary IV line. It's going to be a piggyback. Okay, I would identify the patient, ask the patient the name and date of birth while checking the armband. At this point, I'm going to also ask the patient if they have any allergies, just to make sure if it wasn't something written in the MAR. I'm going to assess the patient, make sure they're not having any pain or discomfort or anything, and everything's fine. So now I'm going to assess the IV line, and in assessing the IV line, I'm looking for any signs of infiltration, any signs of infection, swelling, edema, anything like that. It looks fine, but I'm going to drop the lower the bag just to make sure, and I'm looking for blood return, and that's going to show that it's patent. At this time, I can go ahead and lower my primary IV bag. And in lowering that, I can go ahead and hang my piggyback line. So now I'm ready to go ahead and clean my port, which I'm going to be using the port closest to the primary bag. I'm going to clean it nice all around. Throw that away. I can take the top off, making sure not to touch the tip of it. And then I'm gonna connect it. Okay, so now at this point, everything's connected. I will be using the primary fluid roller clamp to regulate my piggyback, but what I gotta do first is open it up. So I got that open, and now I'm gonna unroll this. So at this point, I'll be using my drop factor, which once I did my math, like I said, I used the 30-minute that was in the drill book. Once I got my math, I came up with 16 drops per minute. I'm gonna divide that by 4 for 15 seconds, and I will get 4 drops per minute, and then I'll stand here for a whole minute. So I'll go ahead and open this up, and I'm gonna count for the first 15 seconds to make sure I get 4, and then I'll stand here for a whole minute to make sure I get 16. So start now. 1, 2. That's too fast. Starting now. 1, 2, 3, 4. So now I can count for a whole minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 16. So that's my minute. So now that I got it regulated, I can leave that hanging. I'm going to reassess the IV line, make sure everything's fine. I'm going to reassess my patient, make sure the patient's fine, the patient don't have any needs. So at this point, I'm done with that part. 30 minutes later, the medicine has ran. The doctor has sent another order to discontinue it. So at this point, I'm going to get the doctor's order again, check to see what he wants the primary rate to be running at, and then I'll go back to the patient room. I'm going to wash my hands again, come in, identify the patient, introduce myself, let the patient know, hey, I'm going to discontinue your piggyback line. I'm going to start running your primary line again, as a primary fluid. And then I'll identify the patient, name, date of birth, reassess the IV line to make sure nothing has changed within those 30 minutes or however long it's been, but 30 minutes since that's what time the medicine ran over. I would roll the clamp, stop it. I'm going to roll this clamp, stop it, and then I can unhook it. Hang that down, lay that down, take this off, rehang this back up. At this point, whatever I checked the doctor order and he said he wanted to run it at, I would reset it by drop factor or by pump. Once that's done, reassess the IV line on the patient, reassess the patient, address any needs, discomfort, and then that's that. At this point, I would go and I would document. I'm going to document the medicine, the rate of administration, the route of administration, the dose, the diluent that it was diluted in, how the patient tolerated the drugs or the fluids or whatever, and then my initials. And this is going to conclude my IV piggyback.